Constipation is a common digestive issue that affects millions of people worldwide. Simply, constipation means having difficulty passing stools. This condition happens when waste moves too slowly through the digestive tract. This allows the colon to absorb too much water from the stool, so the stool becomes hard and dry, which makes it difficult to pass. Normal bowel habits vary from person to person. Some people have bowel movements 3 times a day. Others may only have them 3 times a week. Both can be normal. However, constipation is generally defined as having less than 3 bowel movements a week. We will get to the symptoms in a minute, but now how common is constipation? Well, constipation is incredibly common, affecting millions of people worldwide. In fact, it's estimated that around 16% of adults globally experience chronic constipation. This number increases to 33% of adults over the age of 60. Women also tend to be affected more often than men. Causes of constipation. The causes of constipation are numerous and varied. Often, multiple factors contribute to the condition. One of the most common causes is a lack of fiber in the diet. Fiber adds bulk to stool and helps it move through the intestines. When we don't eat enough fiber-rich foods like fruits, vegetables, and whole grains, stools can become hard and difficult to pass. Dehydration or not drinking enough water is another frequent cause. When the body is low on fluids, it absorbs more water from the colon. This leads to hard, dry stools. Physical inactivity can also contribute to constipation. Regular exercise helps stimulate intestinal activity. People who are bedridden or who have a sedentary lifestyle are more likely to experience constipation. Certain medications can also cause constipation as a side effect. These include some pain medications, especially opioids, antidepressants, iron supplements, and some blood pressure medications. Overuse of laxatives can also lead to constipation over time, as the bowel becomes dependent on them to function. Other than medications, changes in routine can disrupt normal bowel habits. This is why many people experience constipation when traveling or during periods of stress. This happens because the body's internal clock, or circadian rhythm, plays a role in bowel function. So, disrupting this rhythm can lead to irregularity. Ignoring the urge to have a bowel movement can also cause constipation. When we repeatedly hold in stool, the urge to go can diminish over time. The stool continues to sit in the colon, becoming harder and more difficult to pass. Medical conditions can sometimes be the underlying cause of constipation. Conditions that affect the nerves controlling the intestines, like multiple sclerosis or Parkinson's disease, can lead to chronic constipation. Endocrine disorders like hypothyroidism or diabetes can also cause this problem. Structural issues in the digestive tract, such as strictures or tumors, can also obstruct the passage of stool. Pregnancy is a common cause of constipation in women. The hormonal changes and the pressure of the growing uterus on the intestines can slow down digestion. Many pregnant women also take iron supplements, which can contribute to constipation. In some cases, constipation may be due to problems with the muscles and nerves in the pelvic area. Conditions like pelvic floor dysfunction can make it difficult to relax these muscles properly to allow stool to pass. Symptoms of constipation. The symptoms of constipation can vary from person to person. The most obvious sign is infrequent bowel movements. Remember, fewer than 3 bowel movements a week is generally considered constipation. However, for some people, going less often than they usually do can be a sign of constipation, even if it's more than 3 times a week. Many people with constipation experience straining during bowel movements. The stool is hard and dry, making it difficult to pass. This straining can be uncomfortable or even painful. Some people describe it as feeling like they're trying to pass a rock. Another common symptom is the sensation of incomplete evacuation. Even after having a bowel movement, you might feel like there's still stool left in your rectum. This can be frustrating and uncomfortable. Abdominal discomfort is frequently associated with constipation. You might feel bloated or have a general sense of fullness in your belly. Some people experience cramping or sharp pains in their abdomen. In severe cases, constipation can lead to abdominal distension. This is when your belly looks visibly swollen or enlarged due to backed up stool and gas in the intestines. Constipation can also cause a decrease in appetite. When your digestive system is backed up, you might not feel hungry. Some people even experience nausea. Chronic constipation can lead to hemorrhoids or anal fissures. Hemorrhoids are swollen veins in the anus or lower rectum. They can cause itching, pain, and bleeding during bowel movements. Anal fissures are small tears in the lining of the anus, which can cause sharp pain and bleeding. In rare cases, severe constipation can lead to fecal impaction. This is when hard, dry stool becomes stuck in the rectum and can't be passed. Fecal impaction can cause severe abdominal pain and may require medical intervention to remove the impacted stool. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of constipation. To diagnose constipation, your doctor will ask about your bowel habits, diet, physical activity, and any medications you're taking. They'll want to know how long you've been experiencing symptoms and if you've noticed any changes in your stool. During the physical exam, your doctor might gently palpate your abdomen to check for any masses or areas of tenderness. They may also perform a digital rectal exam. This involves inserting a gloved, lubricated finger into the rectum to check for any abnormalities and to assess the tone of the anal sphincter. In most cases, these steps are sufficient to diagnose constipation. However, if your doctor suspects an underlying condition or if your constipation is severe or chronic, they might order additional tests. Blood tests can check for conditions that might cause constipation, such as hypothyroidism or diabetes. They can also check for signs of inflammation or infection. Imaging tests like X-rays or CT scans of the abdomen can show if there's a large amount of stool in the colon. They can also reveal any structural abnormalities that might be causing constipation. In some cases, your doctor might recommend a colonoscopy. This procedure allows them to examine the entire large intestine for any abnormalities like tumors or areas of narrowing. For people with chronic constipation, tests to evaluate how well the colon is working might be necessary. These can include transit studies, which measure how long it takes for food to move through the digestive system, or defecography, which uses X-rays to show how well you can pass stool. Treatment for constipation. Treatment for constipation depends on its cause and severity. One of the first steps in treating constipation is increasing fiber intake. This can be done through diet by eating more fruits, vegetables, whole grains, and legumes. Fiber supplements like psyllium husk can also be helpful. It's important to increase fiber intake gradually to avoid gas and bloating. Staying hydrated is crucial. Drinking plenty of water and other fluids helps keep stools soft and easier to pass. Aim for at least 8 glasses of water a day, more if you're active or in a hot climate. Regular physical activity can help stimulate bowel movements. Even moderate exercise like a daily walk can make a difference. If you have a sedentary job, make an effort to move around regularly throughout the day. Establishing a regular toilet routine can be helpful. Try to have a bowel movement at the same time each day, ideally after a meal when the urge to go is strongest. Don't ignore the urge to have a bowel movement when it comes. Over-the-counter laxatives can also provide relief for occasional constipation. There are several types. Bulk-forming laxatives work by absorbing water and swelling in the intestines, creating larger, softer stools. Examples include psyllium and methylcellulose. Osmotic laxatives, on the other hand, draw water into the colon to soften stool and increase bowel movements. Miralax, or polyethylene glycol, is a common example. Finally, we have stimulant laxatives, which cause the intestines to contract, moving stool along. These should be used sparingly as they can be habit-forming. For chronic constipation or severe constipation that doesn't improve, your doctor might prescribe medications. These can include prescription laxatives or drugs that increase fluid secretion in the intestines, like lubiprostone or linaclotide. It's important to note here that while laxatives and other treatments can provide relief, they don't address the underlying cause of constipation. Long-term management usually involves lifestyle changes to prevent constipation from recurring. Now, we want to hear from you. Do you or someone you know have constipation? What treatments worked for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.